Hi, my name is Dr. Garth Sliz, and this is the diagnosis of premature atrial contraction. As usual, we begin by analyzing the P waves. So we look at the inferior leads, and we do identify P waves, but unfortunately, even with the upright P waves, we find that the RR intervals are irregular, so we need to consider the problem. So let's look at the rhythm strip of lead 2 along the bottom of the ECG, and there we see a long RR interval followed by a medium one and then a short one, and that repeats. So if we look down a little farther, we do see some regular RR intervals, which is confusing, and we are not really seeing an overall regular pattern. So let's look back at the original leads, and when we look closer, we can see that there are a couple QRS complexes that come early without a proper P wave. And then we notice that after these, there is a prolonged time period before the next P wave. So what we are seeing is some premature atrial beats with nice narrow QRS complexes with gaps after the premature beat. So the premature depolarization with the compensation of a longer gap afterwards in amongst normal sinus rhythm causes an irregular QRS with upward Ps and a somewhat regular QRS depolarization, and together this shows us that we are having premature atrial contractions.